Hi everyone. In this video, let us discuss about minocycline. Minocycline is one of the medications that belongs to the group of tetracyclines. This medication can be used for the treatment of multi-drug resistant bacterial infections. Among the tetracyclines, this medication is having few advantages and it is available both in tablets as well as capsules. One of the advantages of minocycline is that this medication shows high absorption. Around 80 to 90% of the medication is available to the systemic circulation. Therefore, it can be used at low dose to treat bacterial infections. This medication is effective against both gram-positive as well as gram-negative infections, particularly which are resistant to multi-drug regimen. Third advantage is that along with bacterial infections, minocycline can also be used for the treatment of rheumatoid arthritis. This is a autoimmune disorder which produces joint pains and inflammation. Even the exact mechanism is not clear. Minocycline is also effective in the management of rheumatoid arthritis. Therefore, in this video, we will discuss the important facts of minocycline and how it works, what are the important precautions, side effects, dosage, all these things we will discuss in this video. First of all, let us see how this medication works. Minocycline works by inhibiting the bacterial protein synthesis. The protein synthesis in the bacteria can take place by addition of each amino acid carried by tRNA. In this process, the attachment of tRNA to the A site of the bacterial ribosome is important, which initiates the addition of each amino acid according to the codons specified in the protein synthesis. Now, minocycline is going to inhibit the protein synthesis in the bacteria by binding to the bacterial ribosomes. It significantly binds to the 30S ribosome with a additional action on 50S ribosome. By binding to these sites, it inhibits the attachment of tRNA to the A site of bacterial ribosome. This prevents addition of each amino acid that inhibits the growing peptide chain. In this way, minocycline can inhibit the bacterial protein synthesis, thereby it can inhibit the growth of the bacteria, which may also produce some cidal action on the bacteria, reducing their levels in the body. Now let us see the precautions of this medication. In people with renal impairment, minocycline should be carefully used because this medication can develop one of the condition, azotemia. This is a condition of increased nitrogen waste that is accumulated in the body. It can also increase the levels of blood urea nitrogen, which may produce various side effects like anorexia, nausea, and even increased acidosis in the body. Therefore, in the people with any renal impairment, the dose of minocycline should be properly adjusted, and when it is used for prolonged periods, renal functionality should be closely monitored. Use of minocycline may produce superinfections. These are the infections which are developed due to increased resistance or due to the decreased immune response. Minocycline is a tetracycline that effective against bacterial infections. However, it may also alter immune response. That's why a development of superinfections may be possible with use of minocycline. Whenever this medication is improperly used for treating the infections, again superinfections may be developed. Particularly, use of minocycline may develop fungal infections, and in a few people it can also develop bacterial infections. Therefore, minocycline should be properly used for the right indication, and in case of any development of superinfections, this drug should be discontinued. Minocycline can also produce vestibular reactions. This medication can enter into the CNS, thereby it can produce some vestibular disturbances. This may result in the development of lightheadedness and dizziness in the people. It may also produce vertigo, reeling sensation, and spinning sensation. It may be associated with nausea and vomiting, and it can also alter the alertness in the people. Therefore, minocycline can induce some vertigo, confusion, which may reduce their abilities to perform daily activities. That's why on the first few days of the treatment with minocycline, care should be taken while handling the machinery or even driving the vehicles. Another important effect of this medication is the development of photosensitivity. When this medication is used, people are more sensitive towards sunlight. Therefore, on prolonged exposure to the sunlight, they may have few skin reactions because of photosensitivity. They may develop burning sensation, itching, and redness on the skin when they are exposed to sunlight directly. In case of development of photosensitivity, long-term exposure to the sunlight or tanning equipment should be avoided as it may produce skin inflammation and allergy. And if it is required, sun protection cream should be applied in people who are sensitive to the sunlight. Minocycline can also increase hyperpigmentation. More number of pigments may be deposited locally, and these pigmentation can be observed on the nails, bones, skin, and even eyes. However, this hyperpigmentation cannot be observed on short-term treatment. When this medication is used for several weeks, there may be a chance of increased pigmentation. Even though this is reversible, this pigmentation may be slowly restored after stopping of this medication. On the skin, hyperpigmentation may result in dark lines and patches. In a few people, minocycline can produce diarrhea, particularly a watery diarrhea may be observed, which may be severe due to development of any super infections. Even though it is not common in all people, use of minocycline may result in a condition called pseudomembranous colitis. It is an inflammatory condition in the colon due to the development of super infections. This may result in severe diarrhea, loss of body fluids, and even sometimes blood in the stools. If you observe any severe diarrhea with use of minocycline, immediately this drug should be discontinued. Now let us see the side effects of this medication. One of the important side effects of minocycline is the dyspepsia. It produces indigestion and even it can produce some abdominal pain. Other side effects like dizziness, lightheadedness can be observed. It can also produce some vertigo and reeling sensation. Photosensitivity is another important side effect produced by this medication on long-term use. These are the common side effects produced by minocycline. However, this medication can also produce few of the serious side effects in a few people. It may produce excessive headache, which indicates a central effect of this medication. It may also induce watery diarrhea and bloody stools due to any super infection leading to pseudomembranous colitis. Even it can also produce some joint pains and difficulty in movements. In case of development of these serious side effects, this drug may be temporarily discontinued to restore the conditions. Now let us see how to take this medication. Minocycline is available as tablets as well as capsules. It is available as immediate release tablets as well as extended release tablets. The dose of this medication depends on the type of infection you are going to treat. Normally, the immediate release tablets can be used at a dose of 100 mg given twice daily. However, this dose may be variable based on the patient conditions and the type of infection. In case of extended release capsules or tablets, it can be started at a dose of 40 mg given once a day. These are the typical dose of minocycline, but the real dose of this medication depends on patient's conditions like renal functionality, hepatic functionality, and the severity of the infection. So that's all about this medication, minocycline, which is a tetracycline that is used to treat multi-drug resistant bacterial infections. This medication can also be used for the treatment of rheumatoid arthritis, and minocycline mainly inhibits the bacterial protein synthesis with a little activity on immune reactions. Vestibular side effects and photosensitivity are the important side effects produced by this medication. So that's all for today. I hope this video is useful to you. Thanks for watching. See you in the next video.